Welcome everybody. My name is Corey from Stylez, the app for all things hair and beauty. And we're really excited to be coming to you live from Fort Lauderdale in the beautiful Dermalogica Institute. So before we get started for the chemical peel class, there's 3 quick things of housekeeping to go over. But first, we're all here. We're all very excited. We're all very ready. We got a camera crew, the Stylez team, and a live student audience, so it's going to be super fun. At the end of this, you can get your completion certificate for watching this peel class. If there's any questions, go to helpme@milady.com and they can answer those questions for you. And according to CDC guidelines, all of us, so I have no mask on, but that's because we're on camera, but we're vaccinated, we've been tested, and everybody else has masks on. So we're trying to be safe, and you all should be too. And so today, if you guys are wanting to learn about chemical peels, you're in the right place. Sarah, who's going to be introduced here in a second, is a master, and she usually does this in a 3-hour course. And she's condensing it down to just 60 minutes, so you're going to be full of insightful information from her that's going to help you actualize your opportunity in skincare. So we're really excited. Later on, you'll be able to see more Dermalogica content on their site, of which we'll tell you about, or even in their channel in Stylez, which is launching soon. But without further ado, I would love to introduce a licensed cosmetologist, a skin therapist, and a master educator with Dermalogica, Miss Sarah Miller. Come on, please.
Hi, everyone.
So we're excited to have Sarah here. We actually filmed together a couple days ago,
Yes.
some other video content, and she was amazing. It was super fun, super good. So you guys are all in great hands. And I know you're going to go over a little bit about your background.
Sure.
And tell everybody what they're going to be going through today.
I absolutely will. Thank you so much for having me. So appreciate it.
Have fun.
Milady, Dermalogica, Stylez, Corey.
Yeah.
We had a great time on Saturday. So happy to be back live with all
See
of
you soon.
you. And thank you guys for coming in person. It's so great to have students in person as well as streaming in. So thank you all. As Corey mentioned, my name is Sarah. I've been with Dermalogica as an instructor for a little over 9 years, and I've been a licensed cosmetologist for over 13 years and skin therapist. So very excited to talk about chemical peels today. I want to jump right in, and we're actually going to talk about what chemical peels are, how they work. We're going to go into ingredients. We're going to talk about safety, consultation. We're going to be, really focusing in on some theory first to just kind of lay the foundation for you. Then we'll be switching gears and going into a demonstration. So I'll get my model on the bed, and I want to show you how we can really customize a chemical peel for the model's concerns. So I've already kind of prepped and performed her consultation, but we'll discuss some of her concerns together and really connect some of the ingredients we're going to be learning about today for you that are kind of streaming in with us. So really excited to jump right in. So for those of you that have not added chemical peels to your service, this is one of the most requested services in the skincare industry. So if you have not already added this to your menu, or you have not already maybe taken classes and gotten certifications, now is the time. I'm glad you're here. This is a perfect first step, taking this 1-hour webinar with us today, because chemical peels not only are going to increase your clientele, it's also going to increase revenue. So there's a lot of really just openings for this particular service. What is a chemical peel exactly? A chemical peel basically is going to be removing outer layers of the skin by applying different chemicals and different ingredients in high and low percentages depending on what you're working with. So how it works, if you're working with alpha hydroxy acids or beta hydroxy acids, is the percentages that we're working with are going to be controlling the different depths of peels. So we're going to be talking about different classifications of peels, and there's kind of 4 classifications that I want to review with you today. So how we're applying our chemical peel and the ingredients, we're going to look at factors that really determine the effectiveness of the peel and everything else, so stay tuned for that in a moment. But first I want to look at how deep we're actually working and kind of the depth of the peel kind of in general. So when we're thinking about applying these ingredients and these acids to the skin, the percent, the pH, how long we leave the ingredients on the skin is going to determine how deep we're working in the layers of the epidermis and potentially the dermis. So I always want to make sure to mention that always check your state local regulations, your state licensing, because each state may be slightly different with your guidelines. We're here in Florida, so in Florida we are able to perform very superficial and superficial peels, which I'll go into, but definitely make sure, depending on where you're streaming in from, to check with your state guidelines for your actual license. So when we think about these 4 different classifications and depths of peels, the deeper that we're going to be working, the more downtime that's going to be involved, the more home care is important, and the more we can treat, more advanced skin concerns and conditions. So superficial peels are really something that many of us are probably already pretty comfortable with. This is something that we're performing without even realizing it every time we perform a skin treatment for the most part. So when you're exfoliating with mild, retail even exfoliants, you are removing part of the epidermis. And we're usually just going to be kind of affecting the stratum corneum, that topmost layer of the epidermis. So think more of your retail, gentle formulations, your low percentages of acids. That is going to be considered a very superficial exfoliant. So we're not penetrating the granular layer. That is really the kicker. When we start to look at downtime here, minimal to no downtime when we're performing very superficial peel. So again, think when you're performing a regular professional skin treatment. When we get into superficial peels, which is the second classification, that's what we're going to be performing today. So superficial peels, there's going to be a little more downtime involved. There's going to be more of that re-epithelialization process because we're removing more layers of the skin. So superficial peels are going to be passing that stratum corneum, they are going to be passing that granular layer, and they do have the ability to get to that basal layer or germinativum, so that lowermost layer of the epidermis. Now again, with our license scope, we're only able to work in the epidermis, so we're not going to be going past that germinativum layer. When we get into kind of the process of what's happening right after you perform a very superficial or superficial peel, well, first of all, your skin's going to feel kind of tight afterwards. You may feel some sensitivity, you may feel red, you may feel some inflammation. It's possible to feel dry for a couple of days. On average, I would say it takes around 1 to 5 days to start to really experience that peeling kind of process, and then 5 to 10 days for it to completely kind of finish. Most of the time. Sometimes it can take slightly longer for superficial peels. Now, the next kind of classification that we talk about is medium depth and deep peels. So medium depth peels are typically performed by medical professionals. These are going to be reaching more of the dermis. We are going to be working more on scars, more advanced signs of aging. And then when we think about deep peels, again, performed by a medical professional, more advanced scarring, more photo damage, extreme photo damage, things like that. More downtime involved for sure here. So 4 classifications of peels that we want to feel comfortable with, 2 that we're really concerned with as licensed skin therapists. So what can these superficial and very superficial peels treat? Hyperpigmentation, skin aging, breakouts, dehydration, texture issues. I mean, the results are incredible with chemical peels, so you're going to get fabulous results. So definitely take before and after pictures when you're working with chemical peels, because your clients are really going to be impressed by the journey that you're able to take their skin on. So now that we've kind of laid the foundation, what is a chemical peel, right? It's a controlled trauma or controlled wound. We're removing outer layers of the skin. We have 4 classifications. I now want to move on and talk a little bit about what can affect a peel, so the efficacy. Because there's a lot of different factors that can change the outcome of the chemical peel, right? So there's ways we can make the peel stronger. There's ways we can make the peel potentially powered up. There's ways that the peel can potentially, we can have reactions if we're not careful. So the first thing I want to really cover with all of you today is the skin health. So the healthier the skin, the better the result you're going to be getting with your clients. So we do not recommend performing a chemical peel on a first-time client. That is not going to be a good choice. So when you're performing a treatment on a client, perform a regular skin treatment first. Get to know their skin. Really getting that thorough consultation, that thorough skin analysis. See how they respond to other exfoliants first. How is their skin responding when it comes to more mild exfoliants before working them into chemical peels? So definitely not for a first-time client. coming back to that healthy skin kind of category, healthy skin is going to respond much better. We're going to get a more even application of the chemical. We're going to get penetrating at the same time. We're not going to have that potential of that adverse reaction. Think about it. If someone has really dehydrated, cracked, open, impaired skin, they're probably going to feel it a lot more over here. It's going to be super uncomfortable, whereas over here, they might not feel anything at all. So we can definitely have some adverse reactions if the client is severely sensitized or severely dehydrated. So healthy skin, we really want to be working with when it comes to peels. The next thing to look at is something called skin priming. So skin priming is what the client is doing at home before they come to get that professional peel with you. So it's always a great idea to recommend professional products to use at home, so retail professional grade products. Have them on the right cleanser, the right moisturizer. Get them exfoliating at home. If you have a client that's a soap and water user and then they come in for a professional peel, you're not going to get as good of a result as if you have a client using the right cleanser, the right moisturizer, and someone that's already exfoliating their skin. The peel is going to just be so much more responsive. You're going to get a much better result. So I like to recommend retinol-based serums to my clients prior, alpha hydroxy acid-based exfoliants if that's appropriate for their skin. Something that's going to just help prime the skin, so when I go in to do the peel, it's a partnership. They're working on their skin at home, I'm working on their skin in the professional treatment room, and we're getting amazing results together. Now, of course, they would discontinue that retinol or alpha hydroxy acid-based product before coming in for the peel, a few days before typically, depending on the strength that you're working with. Now, the next variable that can affect the peel is how you prep the skin before performing the peel itself. And then I also like to think of post as well. So we can power up our peel with the cleanser choice. So if you decide to choose a cleanser that's maybe a little more active, maybe something that has salicylic acid or glycolic or lactic, before you even get into your chemical, the peel itself is going to be slightly more aggressive, right? It's going to be more active than if you use a cleanser that's more inactive, something a little more on the gentle side. So how you prep the skin before even applying the acid or chemical is going to really make that difference as well. What I put on after definitely makes a difference as well. So for example, once I neutralize my chemical peel today, I have the option of applying serums to increase that kind of action on the skin. What if I decide to apply a retinol serum right after that chemical peel? That's going to send that client home with some active ingredients that's going to continue kind of that peeling process in a sense, right? A little bit more exfoliation at home I'm sending them home with, followed by the moisturizer and the SPF. So there's definitely ways that we can enhance the peeling process prior and after. Now, the next thing I want to think about are some ingredients, and we're going to get into a lot of ingredients today, which I'm really looking forward to, because there are so many popular ingredients when it comes to chemical peels. So just being able to think which ingredient is going to be best for your client's skin type and skin condition will really help you when it comes to selecting peels that you want to bring into your business. So types of ingredients are going to really be dependent on the efficacy as well. For example, if I'm working with glycolic acid, that's going to work completely different on my client's skin than if I'm working with an enzyme. So for example, enzymes tend to stay right on the top of the skin. They're like little Pac-Men, that's what we like to call them. Little Pac-Men just digesting keratinized protein. So we have these dead skin cells. The enzyme is just kind of digesting that keratinized protein, staying more very superficial, kind of on the surface. Whereas glycolic acid is more of a water-loving ingredient. It's an alpha hydroxy acid, and it has a really tiny molecular size. So when you put glycolic acid on the skin, it's not going to stay on the surface. It's going to get right into the skin, and it works very quickly. So what that does is it typically, your client feels it a lot more, right? It's going to penetrate quick. It's a very small molecular size. Glycolic is actually one of the smallest molecular sizes that we work with when it comes to chemical peels. So really be aware of that when you're designing your treatment or thinking about what acid you want to work with on your client's skin. If I have a client that maybe hasn't had a chemical peel before, I don't know if I want to jump right in with a glycolic type peel. I might want to use something that's maybe a larger molecular size. So definitely the type of ingredient will make a difference with the efficacy because of the size of the molecule, how it functions. When we think about beta hydroxy acids, they're oil loving, so they actually are going to be lipophilic. they're drawn into the follicle, so they're going to be working differently as well, and they have a larger molecular size. They can be anti-inflammatory, which is really fantastic. What about the concentration? So the higher the percent of acid, obviously, that is going to create a stronger peel. The pH. pH is so important when it comes to chemical peels. Really learning the pH of your products, finding out the formula pH is great, because if you're working with low pHs, there's going to be more cell turnover involved, more cell renewal. So remember, the lower the pH typically, the stronger the acid. Last but not least is, of course, our application method. So when we think about how we apply the peel, we can apply the peel with different types of things, and it all depends on your manufacturer. So I cannot stress this enough. Today I'm going to be demonstrating the Dermalogica Pro Power Peel. Always follow the manufacturer's guidelines of the brand or company that you're working with. So if they maybe are having you use a brush, a Q-tip, a cotton to apply the peel, perfectly fine. I'm going to be working with a piece of gauze today to apply my peel. So application method definitely matters. Now let's look at some safety. So I want to just grab my consultation card, because the next thing we want to look at is it's all about safety with chemical peels. This is one of the largest areas of liability when it comes to the skincare industry. So we want to protect ourselves. You do not want to be in a position where your client, doesn't fill out a consultation card and then they end up having some sort of adverse reaction, an allergy, or maybe they did something they weren't supposed to do and they ended up booking for a peel. So step one, get your client to fill out a consultation card prior to performing the service. Step two is always have your client fill in a peel consent form. So we actually have a separate peel consent form that we have them fill in addition to the consultation card. So that's going to be important. This is going to cover everything that you need to know to make sure that they're safe to receive the treatment. So I want to just briefly cover a couple of contraindications to be aware of, but again, depending on the acid that you're working with, the brand, the manufacturer, you want to make sure you're double checking that everything is covered. Pregnancy, contraindicated for chemical peels. Breastfeeding, contraindicated for chemical peels. Any recently resurfaced skin, so if they've had microdermabrasion, laser, light therapy, IPL, we usually want to wait a minimum of 2 weeks before we perform a chemical peel on their skin. If they are on any acne medication, right? We have so many clients that are taking different medications prescribed by dermatologists, so we would make sure that we're not performing a peel on anyone taking any kind of acne medication, internal or topical. Accutane is the biggest one that we have to be careful with. That one we need to make sure our client is off of it for 6 months. So really, really important. They cannot get a chemical peel for 6 months after they've taken that last pill. Other things to think about, waxing, so at least 72 hours, recent sun exposure. So just really having that complete consultation is crucial when it comes to chemical peels. And then just some other tips that I find helpful when it comes to peels, have an eye wash station, right? So for some of our clients, they talk and they're opening their eyes the whole time. We want to make sure that we're protecting them. So having an eye wash station nearby or in your trolley setup, just in case you have to quickly, rinse the eyes, it's very important. Making sure that you're wearing gloves. You want to protect your hands as well as the client's skin during the chemical peel process. I recommend non-latex because latex can interact with a lot of alpha hydroxy acids and negatively. So we want to stick to nitrile, just latex-free gloves if possible. When we think about some other safe practices, again, we mentioned before and after photos, and then always review peel expectations. Again, super important. Clients sometimes see peels on Instagram, or they have a friend that tells them about a peel, and then they come in and they don't really know what to expect. Has that ever happened to you guys before? They come in and they don't know that their skin's going to be sensitive for a couple of days, or that they can't go on a cruise 2 days later after a peel. So have that conversation with them before you perform the service. Are they good to know that there's going to be some downtime involved? Most chemical peels, you have to avoid direct sun exposure for 2 to 3 weeks. So are they okay with that? Can that fit into their lifestyle? It's summer here in Florida, and it really makes it difficult for peels at this moment because some of our clients might be going fishing over the weekend or booking different vacations. They're at the beach over the weekend. So you do need to have that conversation with them, review those peel expectations, post-care and pre-care, super important. Are they expecting their hyperpigmentation to be gone in one peel? So having that conversation as well. What are they expecting from the peel. Discuss a series of peels and the importance of, that progression plan with them. And that will allow you to book their next treatment and their next treatment kind of upfront with them, so they know that having multiple treatments is going to be the best option. So I also like to provide my client with post-care instructions. I think that makes it really easy, whether you have a little card you can give them, quick text message, email, just having some key guidelines for them so they know what not to do. We don't want them picking or pulling at flaking skin. We don't want them to, of course, go in the sun, which we mentioned, but even certain exercise. We don't want them exercising right after a peel. So we cannot create any heat or an increase of circulation to the face. Little things like spicy foods, ton of alcohol, have a chill night after a chemical peel if possible. So again, just, having that conversation up front is super important. So now let's go ahead and switch gears and talk ingredients, which I know you're all excited to talk about. So when it comes to ingredients, there are so many ingredients on the market when it comes to chemical peels. And I'm going to be talking about quite a few today, but there are a lot that we're not going to be able to get to today. So as I mentioned before, keep on doing your homework and research and taking classes with peels because they're just a lot of fun. So I'm going to kind of be focusing in on some of the more popular ones and connecting them to skin types and conditions with you. And then some of the ingredients that I'm going to be focusing in on today in my specific products that I'm going to be using. So the first ingredient that I want to look at is called lactic acid. How many of you here love lactic acid as much as I do? Love it, right? So lactic acid is one of my favorite ingredients to use in my practice as a licensed professional because it suits so many different skin types, conditions, clients' concerns. I'm able to safely use it on all Fitzpatrick scales, which I love. So I know I'm able to use it on my darker skin clients as well as my lighter skin clients, depending on the formulation. So when we think about lactic acid is an alpha hydroxy acid. It has a relatively small molecular size, but it's not going to be as small as glycolic. So you're not going to get as much of that bite or sting that you would maybe get with the glycolic. And lactic acid is what I call a triple threat ingredient because it hydrates, it exfoliates, and it brightens. So having 3 benefits in one, think about all the people that we can benefit from just that one ingredient, right? So at 5% or higher, lactic acid has also been shown to be a melanin inhibitor. So for someone that suffers from hyperpigmentation, you absolutely want to use lactic acid chemical peels. They're going to be really fantastic for hyperpigmentation. So who else could benefit? Well, we said hydration you're going to get from lactic acid. So if you have dehydrated clients, dry skin clients, combination skin, really consider using lactic acid or a blend of lactic acid because that's going to be a really great result. Again, we talked about how it's going to exfoliate. So people that have any kind of texture issues, maybe they're just looking for some plumping and just some luminosity in the skin. I use lactic on my clients that come in that maybe just have balanced skin and they're just looking for kind of a maintenance peel. Lactic's a great way to go because that's going to just be a fantastic option for increasing the hydration in the skin. And then, of course, as we mentioned, hyperpigmentation and then aging even. So if someone's concerned with some fine lines, maybe they're just starting to see some signs of aging, then your lactic formula would definitely be a good choice as well. So the formula that I'm going to be working with does have lactic acid, but we've also added in a few other ingredients. So in the industry, you might be working with chemical peels that are maybe one ingredient, but they also might be blended formulas. So kind of be on the lookout for kind of the different options that you have available as a licensed professional. So the formula that I'm going to be working with is a blend of quite a few ingredients. So we have lactic acid in one of them that's also going to be combined with phytic acid. Phytic acid is derived from rice, and again, a really fantastic ingredient. It's a really powerful antioxidant. It's going to be great for hyperpigmentation, that client that just has a lot of that overproduction of pigment going on with their skin. And then we also have grape juice extract in our blend, which is a really great mixture of alpha hydroxy acids. Again, overall brightening and hydration that we're going to get there. Let's look at a next ingredient. The next ingredient that I want to talk about is glycolic acid. So many of you have probably heard of glycolic acid. It was very popular in the 80s and 90s because it's all about age management. When you hear glycolic acid, instantly what comes to mind should be aging. Aging skin and glycolic are just besties. So when it comes to glycolic acid, this is the smallest molecule size that we're going to be working with, so smallest molecular size of the alpha hydroxy acid family. Again, that means it's just going to penetrate quicker, so your clients tend to feel more sensation with the glycolic acid. So I just like to take that into consideration as I'm designing my treatment, because again, I know my client's probably going to be feeling some sensation, some itching, some tingling when I apply that glycolic, because it does, penetrate very quickly. So glycolic acid's great for cell renewal, cell turnover. That client that's maybe suffering from a lot of collagen and elastin, they're just noticing that it's just not, the skin's not as firm and as tight as it once was. They're maybe noticing some fine lines and wrinkles. That glycolic is going to be a really great choice. One thing I would like to mention, me personally in my practice, I usually don't like to gravitate towards glycolic for first-time peel because it does create a little bit of heat and it is a smaller molecular size. So on my darker Fitzpatrick scales, although glycolic generally can be perfectly fine, it's not always my first choice. I like lactic. I start out with that, and maybe we'll work up to the glycolic if that's going to be the best choice for their skin. So just keeping that in mind. Chemical peels are, an advanced service. So you want to make sure you're always monitoring the skin, you're being very safe, and you're really respecting the Fitzpatrick scale and understanding that our darker Fitzpatrick scale clients can pigment very easily. So we need to be very careful with how we're treating their skin, especially with chemical peels. So glycolic is definitely going to be your BFF for your aging skin clients. The particular formula that I have with our Dermalogica's Pro Power Peel is also going to be a blend. So it does have the phytic acid in there as well, so that rice bran derivative where we're going to get that nice antioxidant. And then we have a peptide in here. And the peptide is very similar to our retinol, so our retinoic acid, really good collagen synthesizer that we have going on in there. So just to name a few of the ingredients. The next ingredient that I want to look at is TCA. TCA stands for trichloroacetic acid. So TCA is definitely one that we need to be very, very careful with. TCA has the ability to frost the skin. So this has the ability to be a medium depth peel. So we need to make sure that we're very careful with how many layers we're applying. This particular protocol with the Dermalogica lineup, we are not able to apply as many layers with this formula, and we have to be very, very careful as we're applying this one. This one is not going to be safe for all of your Fitzpatrick scales, so we're only able to use the TCA on our lighter skin clients. Fitzpatrick 1, 2, and 3 are who that's going to be safe for. We are not going to be able to use that TCA for our Fitz 4, 5, or 6. What we found in our tests was it just created too much heat, and we do not want that. We do not want that melanocyte to start producing melanin. That's the exact opposite of what we're looking to do when we're working with chemicals. So that's not to say that's for all manufacturers, so of course check with the brand that you're working with, but specifically the TCA formula that I have is only going to be for my 1s, 2s, and 3s on that Fitzpatrick scale. So when we think about our TCA is fabulous for advanced signs of aging, wrinkles, hyperpigmentation. It does have the ability to create that frosting or that cell necrosis. So it appears as like this whitening or grayish kind of tint that'll start to form on the skin. It's really the clinical endpoint to a chemical peel when we start to see any frosting develop. I typically see frosting in areas of breakout activity. So you may see some frosting develop maybe on a breakout, in the nasal folds, areas that maybe are a little more dehydrated. It just is basically the skin saying, I'm done. Don't apply any more acid to that area. It's time to now neutralize the peel at that point. So this TCA that I'm going to be working with today, again, is a nice blend. So we do have some other great ingredients in addition to the TCA. So finally, let's move on, because I know time purposes, we want to kind of keep going here. The last formula that we're going to look at is my personal favorite for my own skin, and that is the salicylic acid, mandelic acid, and malic acid formula. This is ideal for your acne, oily, congested skin. So salicylic acid is a beta hydroxy acid, and it loves oil and lipids. So it tends to really be beneficial for congestion, blackheads, clients that have a lot of breakout activity ranging from, just some comedones all the way up to more pustular breakouts. So that nice blend that we're working with, we have the beta hydroxy acids in there as well as the alpha hydroxy acids, is going to be a great combination for really that oily, acne-prone skin client. So again, looking for these ingredients when you're kind of selecting the chemical peel that you want to work with. Mandelic acid and salicylic also are good choices for someone that's sensitive because they're very anti-inflammatory. So if you have a client that maybe you have worked on that sensitivity over the course of a few months, the sensitivity is really under control, they really want to get a chemical peel, maybe you've done a patch test, then doing one layer of a salicylic acid mandelic would be a really great choice for their skin because it's going to be very anti-inflammatory but still give them that jumpstart cell renewal, really work on that texture, and especially if they're also concerned with some breakouts as well. So hopefully that helps just to kind of start thinking about some of the ingredients to start looking for, as well as the skin types and conditions to kind of connect with when it comes to chemical peels. Now I'm going to go ahead and invite my lovely model up here, and we're going to move into demo mode. So I've already cleansed my model's skin. We did our double cleanse. So I'm just going to wrap her up, and we're going to jump right into the peel. So prior to performing a chemical peel, of course, consultation first. Christy has had many peels, and we performed her consultation as soon as she came in today. We cleansed her skin, we cleansed around the eye area, because I knew for time purposes I wanted to be able to just jump right into the actual chemical peel for the demonstration. So let me just kind of get set up here. I've sanitized my hands and just popped on my face shield and mask. Let me just sanitize again. And I'm going to spray her skin first. Are you guys able to hear? Just a quick soundtrack. Good. We're going to just do the pre-treatment face and body spray. So the first thing you're going to do is your consultation. So my client is not contraindicated. She is safe to receive this peel today. So we know that we can move forward. She is concerned with 3 key things. She has some breakout activity along her jawline that she wants me to focus in on. So she gets some stress breakouts through here. She has sun damage on her décolleté, so she wants me to really address the hyperpigmentation in that area. And then everywhere else, she's concerned with aging. So she really wants to focus in on age management everywhere else. So what I want to show you today is how I can actually incorporate 3 different acids in different zones so I can address all of her concerns. That's what's so exciting about this particular chemical peel, is the fact that we can address multiple concerns at the same time. So super exciting. The other thing I'm going to show you today is our Pro Power Eye Peel, because the eye area needs some love too. We have fine lines around the eyes, we get dehydration, some people get milia, texture issues, so we want to be able to brighten and hydrate and exfoliate the eye area, but most chemical peels are not going to be really formulated for the eyes. They need to be at least 1/4 of an inch, even further sometimes, away from the eye area. So hopefully that makes sense for all of you. All right, so I'm going to go ahead and glove up. We're going to get started with our Pro Power Peel. Okay, I'm going to take the mask off and just do the face shield just for sound purposes. Hopefully everybody can hear good. So Christy, after your last peel, no other changes, right, to your skin, just the breakout. Okay, little breakout on the jawline. So that's what we'll focus in on today with the salicylic. So that's perfect. So the first thing that I'm going to be doing is I'm going to actually be applying the eye peel first. Then we'll go into peeling the rest of the skin. So the Pro Power Eye Peel is a bamboo patch. And this is a really nice blend of ingredients. There's alpha hydroxy acids in here, specifically from grape juice. We have aloe in here, so very hydrating. And I love how brightening, it just brightens the eye area. It just looks really nice. So just removing the eye patches with the little tweezers, placing that right back on. I'm just going to smooth this right under the eye area. And you might just feel a little cold. So coming up, not quite to the lash line, but coming up pretty far. And then just smoothing out any bubbles. And we'll do the other side. And then we'll jump into the peel. Perfect. Does that feel okay?
Yes.
So this particular peel for the eyes can stay on for 10 minutes, which allows me 10 minutes to be able to peel the rest of the skin. So all great peels start with prepping. So we've already performed our double cleanse, and we've also already performed our skin analysis. You want to make sure you're performing a thorough skin analysis before applying any chemicals to the skin. Look for any open skin, chronic dehydration, any severe sensitivity. You want to feel for any heat. So really a thorough consultation and skin analysis, crucial. Now we want to degrease the skin. So most peels will have you degrease or prep the skin prior to applying the actual acid. What you'll see is a lot of degreasing agents are going to feature things like alcohol, witch hazel. They might also have alpha hydroxy acids in there. Some even have acetone. So you'll see a lot of different types of degreasing agents kind of out there. The one that I'm going to be working with today has 5% lactic acid. We have SD alcohol in here, and then we have witch hazel. So this is specifically to prep the skin so that when I apply my acid, it's going to not only allow for better penetration, but it's going to let my acid work better, and I can apply fewer layers because the one-step prep allows that. So it's really great. I love this solution. I also like working with the one-step prep when I am performing dermaplaning or other advanced procedures. So it's just a great degreasing solution. So I'm going to take 2 droppers, and this is what I'm going to be applying the peel and the prep solution with. This is a gauze, a 2x2 gauze. So we're going to take 2 droppers. We're going to go ahead and just put that right on, making sure to not touch the dropper to the gauze, no cross-contamination. And we're going to go ahead and start on the décolleté. So just long, flat, swiping motions across the décolleté. Other side. Then we're going to go ahead and come up on the neck. Then we're going to go ahead and come onto the face. So keeping that gauze nice and flat, I don't want to overlap, and I want to avoid the eye patch. We don't want to overlap with the eye patch at all. So working the jawline, the lower cheek, upper cheek, avoiding the patch, lower forehead, upper forehead. Then we're going to finish by folding our gauze and coming down onto the nose and doing the sides of the nose and then along the upper lip. So checking in with my client, do you feel any sensation with that one-step prep? No. Okay, excellent. Feels nice and fresh. Some people do feel a little sensation with the degreasing agent. They might feel like a 1. They might just feel kind of a slight tingling because this has the 5% lactic acid. If they feel a strong sensation, then that's really going to be an indicator that they might not be a good candidate for the actual chemical peel. Because if they are already feeling a high sensation with 5% lactic acid, then you may not want to put on 30% lactic acid, perhaps, right? So what we're going to now do is I have a couple pieces of gauze here because I want to show you I could absolutely select one acid and apply that all over, get a great result, do a couple layers, good to go. But today's class is all about customized chemical peels. So I want to show 3 of those acids that we learned about today in different areas or different zones and how we can kind of address all of her skin concerns. Because remember, she said breakouts, aging, and hyperpigmentation. So let's address everything. So let's start by addressing the pigmentation on her décolleté. So we're going to use the lactic acid that we learned about. Lactic acid, remember, amazing for hyperpigmentation. So I'm going to go ahead and take 1 pump of my ultra bright peel onto my piece of gauze. And we're just going to be targeting this onto the décolleté area. So you want enough product so that your gauze is saturated but not dripping. So we're going to go ahead and swipe right on the chest. And then throw that piece of gauze away. Now we're going to go ahead and apply a different acid to the neck and face. So she does really well with the TCA. So the TCA agrees really well with her skin. It really creates a lot of firming and tightening. So I'm going to take a fresh piece of gauze, and we're going to take 2 dropperfuls of the TCA and apply this to really address areas of aging, firm the skin. This also has a lot of brightening, so again, for hyperpigmentation. So I've fully saturated my gauze. Coming in, swiping up the neck, keeping your gauze nice and flat, working on not overlapping to the best of your ability. And keeping it moving, folding, coming down on the nose, sides of the nose. We apply to the nose last because that tends to penetrate the quickest. It absorbs very fast. There's a lot of sebaceous glands there. Let's check in with Christy and continue to watch the skin. Scale of 1 to 10, tell me how much sensation you are feeling.
A 2.
About a 2, perfect. So checking in with your client, really using the sensation scale is so important when it comes to chemical peels. You want to make sure that you are, checking in, watching the skin the entire time. I want to look for any erythema. She's getting a little bit pink on her chest. That's completely normal. We expect redness. We expect some tingling, some itching with chemical peels. So I'm just fanning her skin. You can also do a little bit of tapping or light kind of feather stroking movements. That will kind of, just stimulate the nerve endings a little because we don't want her to reach up and scratch or anything like that. So overall, her skin's looking fabulous. I'm going to allow this acid to penetrate for 1 to 2 minutes. So that's what our protocol says, 1 to 2 minutes per layer. Now from here, I want to prepare and go into 1 more layer with you and show some spot treating. So the next layer, I'm getting another piece of gauze here. And we're going to go in and do another layer of our ultra bright on her décolleté. Again, that is where she's concerned with hyperpigmentation. So this is the lactic acid formula. Because I'm just doing the décolleté area, I'm just taking 1 kind of dropperful. If I was doing face, neck, and décolleté, you may need 2 dropperfuls. So let's go in for our second layer. Keeping an eye on that one little spot that's gotten a little bit pink there. Now we're going to go ahead and go in, and I want to show you a quick spot treat with the salicylic. So let's address her breakout activity on the jawline. So just kind of a half a dropper, since this is just a spot treating action that we're performing. This is the salicylic mandelic formula. And I'm just going to go ahead and spot treat this little cluster of breakouts that she's experiencing. There and there. Now that does count as a layer, so I want to obviously be watching the skin at that time. But now you can see I've completely customized this peel experience to Christy's skin. We've addressed the pigmentation, we've addressed the breakouts, and we've also addressed the aging that she wanted to focus in on. So from here, we're now going to go ahead and start to neutralize. So we need to remove our gloves and apply new gloves, or you can use your hands, whatever works for you. I'm going to apply a fresh pair of gloves. I'm going to go in and I'm going to remove the eye patch, and I'm going to show you how we neutralize the eyes. And then we'll go ahead and go in and neutralize the rest of the skin. So each layer can stay on for 1 to 2 minutes, and we can perform up to 5 layers of a single acid unless we're working with TCA. If we're working with the TCA, we're only able to perform up to 3 layers. That's going to be working within your licensed scope of practice as licensed skin therapists. So let's go ahead and remove our eye peel. We're going to go ahead and just take those right off. And with the eye peel, you're just going to take cold cotton or cold aesthetic wipes, and we're going to wipe any remaining eye peel from the eye area. So these are nice and cold. I had these in the fridge prior to our class. Now we're going to go ahead and neutralize the rest of the skin. So most chemical peels on the market have a neutralizing solution. So the neutralizing solution that I'm going to be working with today has kind of 2 key ingredients. One is an oatmeal derivative, and the other one is a pH adjuster. So we have our aminol methyl propanol, which is our pH adjuster. It's a really nice glidable product that just really stops that peeling process as soon as you apply it. When you neutralize, a lot of chemical peels, every protocol is going to be different. Some chemical peels have neutralizers, some are leave-on peels, so again, pay attention to your manufacturer's guidelines. This particular peel, as soon as I apply the neutralizer, I sometimes feel a little bit of heat in the skin. And sometimes a client will feel a little spike in their sensation number. So she was feeling around a 2 when we were applying the peel. Did you feel a little spike, or did you feel that heat? I especially felt heat here, a little bit of warmth here.
A little bit in the chest, but it's all
But the face?
fine.
Great. So I'm just spreading that all over the areas that we applied the acids. Light touch. I don't want to be creating any sensitivity on the skin. And then my hands are going to come off, and I'm just going to allow that neutralizer to do its job. So it needs to bring that skin back to that pH balance that we're looking for. So it can take 5 to 10 minutes to neutralize. Christy's skin usually neutralizes really quickly, which is great. So as that's kind of neutralizing, you can also apply cold compresses. So I have cold compresses. I also have a cold towel. This is also a great opportunity to fill in your notes, right? So if you have a consultation card where you can kind of write down how many layers you performed, how long you left the acids on the skin, really keep good records with chemical peels. This is actually the 4th peel that we have performed on Christy's skin over the last couple of weeks. We're doing a series because we really want to maximize our opportunity together. So we've been taking before and after photos. We've really been tracking our success, and the results have been fantastic. Her skin just looks more hydrated. Fine lines are definitely less apparent. So I've been really pleased with the results that we've gotten, and this is peel number 4, so we still have 2 more to go. So we've been trying to see each other every 2 to 3 weeks on average, and it's been going really well. So we don't push it. Of course, you are welcome to perform more layers. It all depends on the client's skin, but she does really well with 2 layers. I've learned what acids her skin tolerates really well. Glycolic is usually a little bit too much for her skin. She tends to get a much higher number, and her skin gets very pink with the glycolic kind of formulations. And that's glycolic in general. So just not just this formula. So just some things to think about. So how are we feeling? Is that number starting to kind of come down? Excellent. So let's put a couple cold compresses. We'll remove this, and then we'll finish the treatment with our toner, our targeted treatment, and our moisturizer and SPF. After a chemical peel, it is really important to avoid chemical sunscreen. You don't want to apply any kind of chemical sunscreen because that can create a lot of heat. That can be very itchy on the skin. So make sure to use a mineral-based SPF, so physical sunscreen, zinc oxide or titanium dioxide. All right, we're going to remove all of this neutralizer with these cold compresses. This just has cold water. These are aesthetic wipes. Do you feel any sensation, or are you feeling back to normal?
Feels back to normal.
Okay, excellent. You have a tiny bit of heat in your décolleté, so I just have this cold towel that we'll do just for a moment, and then we'll go into the toner and finishing the treatment. Nice and cold. So hopefully this was, exciting for you to see in action, the customization that you have available, the different acids. Now, after a chemical peel, this client may feel tight. She's going to have some lingering pinkness. There is a little pinkness on the décolleté. That's all normal. So we're going to see that erythema. We're going to see, the skin's going to feel a little tight for the next few days. And then after, the results are pretty incredible. The skin's going to feel smooth. It's going to look plump, bright, hydrated. So let's now go ahead and go into our toner. So I'm going to go ahead and spray. This will be a cool mist. We're going to apply eye cream, serum, moisturizer, and SPF. The moisturizer that I'm going to be working with and serum, I'm going to be using a vitamin C serum to send her home with. This has a little lactic acid, it has vitamin C. So again, we talked about how we can kind of power up those results by sending her home with some active ingredients, so super exciting. And I'm going to be using a moisturizer that is a little richer for her today. So she usually uses more of a medium weight moisturizer, but after a chemical peel, it's great to use something that's a little bit richer. This has some hyaluronic acid. It's going to be a little bit more lipid based. Most clients after a peel, their skin feels very tight, so they appreciate that extra hydration. And then we're going to finish with our 20% zinc oxide SPF. This is the Invisible Physical Defense SPF 30. How does your skin feel?
Amazing.
Looks great.
Great.
Most of that heat is gone, so I'm very happy about that. All right, I'm going to unwrap you, help you up. Thank you so much. Really appreciate it. All right, I want to invite Corey back up here so we can check in with everybody and start answering some questions.
Yes, thank you. I'm happy to be back. That was
Yes,
amazing.
thank you.
I listened to the whole thing. That was tons of information, so great job. And everybody put in so many good questions.
Good. We had a lot of
So-
questions coming in. That makes me so happy.
The Milady team, all of you that were chatting on the website, sent me a whole bunch of questions. So I'm just going to start from the top.
Okay.
And let's try and go through as many of these as we can.
Let's
They're all
do it.
super relevant. So first, how many days before peel should AHA and retinol be stopped?
Depends on the percentages, but typically we want to wait a couple of days if it's drugstore brand. So if it's something that they're getting retail and not prescription, usually 72 hours is plenty of time. If it's a prescription strength, I like to wait at least 2 weeks. You sometimes can get away with a week, but I know for me personally, I have a prescriptive strength retinol, and I sometimes will get flaking for quite some time. So I like to wait 2 weeks if it's prescriptive strength.
And then I heard you say with her, you've been waiting 2 to 3 weeks between peels.
Yes.
Between sessions.
Yes.
What's the standard for most?
Yeah, that's about right. So there's a range. When you're working with more corrective chemical peels, so a corrective chemical peel meaning someone that really has a concern such as pigmentation, aging, breakout activity, versus someone that's just getting peels for maintenance and just, their skin's pretty balanced. A corrective peel, I like to see my clients every 2 to 3 weeks, ideally, whereas more sensitive skin or maintenance, you could push it to 4 to 6 weeks if you needed to. But you also have to think about budget. If someone can't maybe afford to see you every 2 to 3 weeks, then you can absolutely push it out a little further if needed, and that's fine.
So if you were doing this in a traditional setting, how long would that usually take?
So you can perform a Pro Power Peel 30 or a Pro Power Peel 60. So a lot of times when you're thinking about different brands and different manufacturers, they will have protocols for you to perform a 30-minute peel and a 60-minute peel, which I love. So the treatment we did today would have been a 30-minute service for Christy's skin, but we usually like to do 60-minute treatments for her. So after the peel, we usually go into a mask, we usually go into a little upper body massage so that she gets that full 60-minute experience versus just a 30-minute peel, which is great for jumping in on your lunch break, come in, come out type thing.
And so how does acne, scars affect this, and can you do a peel over acne?
Yes, absolutely. So peels can definitely affect superficial acne scars. I have suffered from acne from a very young age, and peels and microdermabrasion have really helped my superficial acne scars to the point where they're pretty much gone. So peels can help a lot, and if you have active breakouts, like we saw Christy had a couple of clustered breakouts on her chin area, a lot of those, some of them will flatten out and be gone. Some of them may come to the surface, so we can send her home with a spot treatment to use in a few days if that happens. But peels are really effective for acne and scars as well.
Are there any peels you should not use together?
It depends on your brand and your manufacturer. One thing I like is we can customize this lineup of products. I can mix, I can layer. So you saw I had a lot of fun today with the mixing. We just recommend not mixing more than 3 formulas together because we don't want to, go overboard. So, and also just take into consideration what we talked about earlier with the molecular size. So glycolic being very small, TCA is large, your beta hydroxy acid, salicylic acid's a little bit larger. So when I'm designing my treatment plan, I think about that as well. I might not want to start with the glycolic because that client's going to feel it pretty quickly. I might want to start with a molecule that's maybe a little larger to kind of ease them into the service. So you can kind of think about that as you go.
How many days after retinol can how many days after a peel can retinol be resumed?
So again, it depends. I actually have a retinol serum I can apply right after a peel, only obviously in a controlled if the client can handle it. So we could have boosted Christy's treatment today by applying some retinol right then and there, send her home with that. But usually you would want your client to wait about 72 hours before continuing their regular routine. We actually have, and most companies do, have like little kits where it'll be a post-care kit. This is a 3-day supply of some nice calming products that has the physical sunscreen, it has a nice cleanser. So for at least 3 to 5 days, we will have them use products that are gonna calm, hydrate, soothe, and then they could go ahead and go back to their age management type products.
So here's a moneymaker. The question, what type of chemical peel is helpful for eliminating wrinkles?
I would go lactic acid, depending on the skin type. Glycolic's great, but lactic acid just has a special place in my heart because I just get such good results with so many clients.
Okay. And why did you wipe after you take off the eye peel?
So the eye peel does have alpha hydroxy acids in here, so we do have the grape juice extract. So, and the peel, the patch has the solution on there, so I didn't want to leave that solution under her eyes and have her, go out in public with alpha hydroxy acids under her eyes. So you do want, that's basically the neutralizer, wiping the excess exfoliant from the eye area.
So is there a peel that kind of treats all conditions, like a generalized one, that's especially good for new estheticians?
I would start with lactic. What do you guys think? It's great, right? It's just a good option. That's one of my favorites. Salicylic's also a great option just because it's anti-inflammatory, so it will suit a wide range of clients. But the lactic, I tend to use the most in my practice, for sure.
So last question, and there were many, thanks everybody for submitting these, but wearing makeup is okay right afterwards, and what about
Ooh, I
sun
like that
exposure?
one. Makeup. So again, some peels will say no. I like my clients to not wear makeup right after. Technically, they can put makeup on after this particular peel. We have a tinted primer that I will put on for some clients if they're really, tempted to run and put foundation on. I really like them to take a break that day. Ideally, give your skin a little break from makeup, put it on the next day, but you can safely apply makeup after this peel technically. That would be fine. Sun exposure, you want to avoid direct sun exposure for 2 to 3 weeks after the Pro Power peel.
Okay, I lied. This is the last one. Can we see men face treatment that have beard?
Yes, I actually did a peel last night on my husband. He has a full beard. So when you are performing peels on male clients, if their beard is really long, then I just avoid this area because you're not going to be able to get to the skin if the hair is this long. So I'll just apply the peel where I can actually get to the skin.
Okay.
And so he'll do a little bit of a trimming. So I would actually go right over Corey's skin, right on top, and that would be perfectly fine because you're still going to be able to affect the skin. If he's suffering from ingrown hairs or if there's pigmentation under the beard or texture issues, for sure, you want to be able to peel male clients' skin. It's just a matter of if the beard, once it gets probably about an inch, forget it. So you would just avoid that area, basically.
Does Dermalogica offer natural peels for holistic care?
So enzymes, maybe that might be the question. If they're looking for like fruit enzymes or plant-based enzymes, yes, we do have a pumpkin peel. So it's a 10% lactic, 10% pumpkin. It's called our Rapid Reveal peel. That's a really nice option if someone wants more of a plant-based kind of situation. Our daily microfoliant has our rice and our enzymes. So we do have good options if they don't want higher percents, because today we were working with 30% lactic, 30% glycolic, 15% TCA, for sure.
So for everybody, thank you for tuning in.
Yes, thank
You're
you so
going to be
much.
able to
Thank all
watch
of you.
this again. It's going to be, we've captured it, recorded it, we're going to edit it all, and it's going to live within the Milady training platform so you can see it later. And make sure, obviously, to get your certificate of completion, so you guys have that to your credit. Sarah, you're obviously amazing. The
Thank you.
compliments that everybody was giving
Appreciate it.
on the
Thank
chat.
you guys.
Yeah.
I was trying to get everything in, so I apologize if I was talking fast, but I'm like, I want them to hear all of the things. But feel free to reach out to me if you have any questions that we didn't get to. I am on Instagram, happy to answer anything at all about peels or any questions that you have when it comes to skincare.
Yeah, her handle is at Dermalogica Sarah, I
Yes,
believe.
that's right.
And then you can see more Dermalogica at their website, pro.dermalogica.com, I think.
Yes, pro.dermalogica.com for more information. For sure. Thank you all so much. Really appreciate it.
Thank you, Milady, for having us. Thanks, everybody, for tuning in. Until next time.
Are we off air?